Are there advancements in medication or complementary therapies to improve the quality of life for individuals with autism?
Actually, as we mentioned before, that the early intervention and treatment, whether includes medications or procedures, will help to improve the life of individual with autism. The interventional courses or treatment for autism, mainly includes the behavioral therapy, occupational therapy, physiotherapy, speech therapy, and other complementary. The complementary medicine, or which is the non-traditional, what we call it, some advice for nutritional therapy, others doing, hydrotherapy, oxygen therapy, and so many other acupuncture. There are so many. If you go online, you could see so many other things, but they are all not documented clinically. The medications only used for certain conditions that affect the individual with ASD, like for instance hyperactivity, because most of ASD individuals, almost 50% of them, they have hyperactivity and attention deficit, what we call it ADHD. And sometimes these symptoms and signs very severe that affect the individual and makes his social life very, very difficult. So this means that he needs certain medications, and the medication is usually prescribed by a child psychiatrist. And also there are certain other medications to help for if there is any sleep disorder, certain medications for anxiety, for depression. It depends on the case, on each case of the individual. Not all of them, they need certain medication. But intervention, as I mentioned, it's greatly needed. Nowadays, there are so many research done to find certain new medications for ASD. There are trials to include the marijuana, the CBD oil in the treatment of ASD. Some of those treatments proved good results, but it needs further research. Some companies also found derived a particular ingredients in that CBD oil from the marijuana, and they mentioned that this will help a lot the behavior in cases of individual with autism, and this is also need to have to be tested by clinical trials. And there are also, for instance, some people usually ask, how about stem cell therapy in autism? There were many trials, clinical trials done in Duke University in USA. Actually, 2 clinical trials. They proved some good results in certain individuals, especially when it is used early in life, before the age of 3. But once, in older ages, they couldn't find very remarkable results. There are certain also research that is going on gene therapy, but to me, until now, the history tells that there is, till this minute, there is no clinical, no medical cure, no treatment for autism. Like, for instance, if you compare treating diabetes, treating hypertension, or other clinical or diseases, we don't have any cure for autism, but we have this intervention which might help a lot the condition it makes life easier for individual with autism.